I wanted to set the stage. Imagine your buddy Jason invites you out to coffee and says, "Cancer came to my house." He goes on to explain how his wife Jennifer was diagnosed, and after surgery and treatment, she was really physically weak, she was depressed. Their care providers gave them a great big binder of materials and said, "Here's your survivorship packet, and this is what you need to do to recover." But they were feeling overwhelmed, lost, and they really didn't know where to start. So Jason and Jennifer are not alone. 90% of cancer survivors report some type of impairment post-treatment, whether it's mental, physical, or emotional. 40% report some type of chronic pain, and according to the American Cancer Society, only 63% are living beyond the 5-year average. Healthcare payers and providers have problems as well by the sheer volume of cancer survivors predicted to be 18 million by 2020. There are higher costs for recurrence of disease, and there's higher costs for readmission. 20 years ago, cancer came to my house when my dad was diagnosed with a rare blood cancer. His diagnosis set me on my course to serve the cancer community as a cancer exercise specialist. When we look at survivorship, it needs to be customized depending on a person's diagnosis and their treatment regimen. Whatever the diagnosis, however, patients need access to affordable exercise, wellness, mindfulness, and community. Our initiatives look to expand oncology rehab because it sets the precedent that exercise is an integral part of cancer recovery, addressing issues such as lymphedema, balance issues, muscle wasting, but sadly only a few cancer survivors are prescribed rehab. Research shows that exercise can reduce the recurrence of subcancers up to 50%. And when it comes to outcomes, we're looking at different methods and modes. Survivors have wellness needs just like the general population, but some of their issues are more pressing. Think about psychosocial needs, think about sexual health and reproductive needs, think about physical function. Whatever the concern is, we need to have a diversity of services along the care continuum. Some of that will be clinic-based oncology rehab, maybe it's community-based cancer exercise or mindfulness, leading people to self-managed care. Innovation is going to be the key in terms of progressing survivorship and wellness services, whether it's mobile technology platforms, cancer exercise specialist classes, using virtual and telephonic communications. The shift in payment models is going to help set the stage for valuing outcomes. So aligning payment with outcomes through several systems that are experimenting with that currently, and aligning policy with outcomes, which is something we're committed to do through the Minnesota Cancer Alliance. One of our initiatives works way upstream, thinking about integrating oncology rehab, survivorship service, and wellness plans in medical school curriculum so physicians can start thinking about it when they enter into medical practice. So as we're looking at these objectives, who is already engaged in these types of services and how can we come alongside with them and partner? What's the change potential? Is it policy? Is it systems? Is it environmentals? And where can we collaborate in a sustainable way? And for us, the Minnesota Cancer Alliance, where's the thread of health equity that permeates every part of the initiatives that we're committed to pursue? When it comes down to it, what are we really trying to do? We're trying to improve the quality of life. After a cancer diagnosis, we're looking at improving physical function, reducing psychosocial distress, reducing the relapse of disease, and frankly, survivorship needs to be a whole lot better. So let's address problems facing survivors in healthcare, customize survivorship support based on diagnosis and cultural competence, expand the services of oncology rehab, develop innovative programs utilizing technology and community stakeholders, change policy and payment models, talk to the folks in medical school, and we're really seeking collaborations that accelerate sustainable change. The next time someone says to you, "Cancer came to my house," tell them about the work that we're doing at the Minnesota Cancer Alliance. We know that survivors want to do more than survive, they want to thrive. Thank you.